Dr. J. Ram with Urology Associates, and as part of Prostate Cancer Awareness Month, I'd like to talk a little bit about PSA screening and prostate cancer. Since the U.S. Preventive Task Force came out recommending against routine prostate cancer screening with PSA in 2009, a lot of discussion and controversy has been generated about the optimal use, if any, of PSA. While myself and many urologists who treat prostate cancer every day don't agree necessarily with the recommendations, we have agreed that routine screening of all men leads to significant overdiagnosis and overtreatment of men, which can potentially cause significant harm. As such, our approach has changed. We have tried to adopt more of a risk-stratified or a risk-adapted approach to PSA screening, taking into account a man's individual characteristics and risk factors. Men who are African American, men who have a family history of prostate cancer, and men with an initial PSA value that is significantly higher than their peers do have a higher risk of developing prostate cancer and also of dying of prostate cancer, and those are the men that need to be screened the strictest. Men who are older, men who have other comorbidities, and men who have a PSA that is elevated for other reasons, such as an enlarged prostate or recurrent prostate infections or inflammation, are men who are least likely to benefit from a rigorous prostate cancer screening process. Here at Urology Associates, we try to take an individualized approach to PSA screening. By focusing on a man's medical history, their urinary and sexual health, and their specific preferences, we feel like we can identify men who would benefit the most from PSA screening, while avoiding screening in those men who are not likely to derive much benefit. With newer imaging and molecular techniques to help us identify more meaningful and more dangerous cancers, we also feel like we are avoiding overtreatment and thus preserving quality of life in patients with prostate cancer. If you have any further questions or would like to talk to a prostate cancer specialist here at Urology Associates, please make an appointment and we would love to guide you through the process.